So can you walk us through kind of what happened during our AI test, this database reactivation test, and kind of how that dovetailed into kind of what you uncovered?
Yeah, I think the timing of when we got together was perfect for us. As a small business, there's a phase where you're not quite at capacity, and so you're not recognizing inefficiencies. And over time, we've grown to capacity. We've added additional support members, and we've put in these, different parameters on what they should be doing and how they should be communicating with different patients. We had almost 1,000 patients in our database that I would have said fell off the wagon, ran away, or moved away, or what have you. And these are all folks that the office had gone through the old method of reaching out 3 different times through different methods, different times of the day. We would mix it up. Maybe they're a daytime person, a nighttime person, an email person, a text message person. And so we would try and make sure that we did what we needed to do to feel as if we put our best foot forward to try and pull that patient back in to heal again. And based on that, you would say, well, these people were already chased and we didn't get any traction. And so we're assuming they're kind of gone forever. When you approached us, and said, hey, I'd like to take a crack at seeing if we can get any traction on those inactive leads, it was like, yes, I'm very curious. I'm very curious to know if we, what additional information we learn or what types of results we get. And I got to tell you, I was blown away. I think, I told you when we first met that anytime somebody comes to me with a newer idea or a marketing type campaign, my expectations are very low. Very low. I guess I've been in business a long time. I know it takes time. I know that, a lot of things need to align properly to have success. And so I really thought we may only get 1 or 2 folks. And, through doing even just a test program with you over the first couple of weeks, we had a huge amount of people respond, communicate with us, and book follow-up appointments again. And I'll tell you, there was a couple different benefits from that. Obviously, we got the patient back, which was fantastic and a win-win all the way around. But additionally, we got a lot of data and information from the patients about either why they weren't coming back or that they would like to come back and why. And that was better than any of the data we ever got from our surveys or from reaching out to patients or trying to stimulate review programs. And, we would get a little bit, but it was always a very small percentage of people that would respond to that type of thing, which didn't give us the confidence that we had the whole picture. And so to go through this exercise with you and utilize leads that we did not think would amount to almost anything, it sort of opened my eyes that there is business there. And in our business, every business is a little bit different. In our business, part of the key is getting people at the right timing. And I'm sure that's true in every business, but it means something a little different in each one. In ours, we got to get people the right time when they might be looking for help and they're open-minded, etc. And so it has given us a new tool to reach out, in a way that people are not upset with us, frustrated, annoyed, and it's on their timing. We're primarily using text message programs, which give people some flexibility with that. And part of what I want to do is continue to go down the rabbit hole and learn even more.